Okay. All right. Great. So we're going to start off first by doing a session about all about portfolio, and I'm hoping that it will be very useful to all of you guys. So, in terms of the learning objectives, today what we're going to be discussing is what actually is a portfolio and the relevance to higher speciality training. And we are going to go through some general domains that make up a portfolio. So just in terms of my background, as I mentioned, so my name is Smega and I am a radiology registrar, currently in the Midlands. In terms of my background, so did the whole, went to secondary school, did my A-levels in state schools. The schools that I went to essentially had a very poor history of sending students to higher education. My aspirations were not great either. So I actually had quite a pivotal entry point into medical school. The year that the year that I became interested, shall I say, in applying to medical school, there was a foundation program that was created at the University of Nottingham, where they were allowing 10 students into the program that came from like a widening participation type background. So somebody essentially took a shot on me, and that was I packed up my bags, aged 18, and I ended up going to Nottingham. Once I finished the foundation year over there, I then progressed onto the 5-year program at university. I also did the intercalation with the outcome being essentially getting my bachelor's in medicine and surgery, as well as getting a bachelor's in the medical sciences. I then progressed by coming back to my local area and did a foundation year 1, year 2, and year 3. I did a variety of jobs, guys. I did literally from psychiatry, respiratory, breast surgery, public health, which not a lot of people get the opportunity to do, endocrine, cardiology, gastro, general surgery, and urology. So I think what this really gave me such a broad base to work from, and it really helped me, particularly when I started my radiology training. And currently, as I mentioned, I'm a 3rd-year radiology registrar, which definitely I think the young me didn't think I would be here. And particularly it always resonates with me that you may dislike a thing which is good for you, and that you may like a thing which is bad for you. But Allah knows best, and you do not know. So next, we're going to talk about why do you actually need a portfolio? So the whole purpose of this session is I feel like my entire journey from applying to medical school, doing medical school foundation program, it was essentially a bit of like a DIY experience where I did not really know what was ahead. And what I want to do is help you guys get ahead with the information that I have. So in terms of the portfolio, it's essentially evidence of your achievements thus far, and it's really required for high specialty training. It is also good for reference for your interview, and it helps you essentially beat the competition. Every speciality wants to know that you have commitment to their speciality, and it's a way for you to demonstrate that. And it doesn't matter whether or not it's surgery, radiology, medicine, you name it, they want to see that whoever is applying to their speciality is committed to their speciality. So a portfolio is made up of samples of your work that demonstrate your knowledge, your skills, your abilities, and your competence. And it provides you a record of your career, essentially up to that date, detailing your achievements, your skills, your qualities, and your qualifications. And it's also very relevant for when you're demonstrating the desirable attributes that are listed in the person specification. But we'll go through that in a little bit more detail. So I'm sure, especially from the undergrad students that we've got amongst us here in the talk, a lot of you have heard about this bottleneck that's happening with high specialty training. And it is a thing. Every single year, the competition ratios is increasing. As you can see, for instance, if you want to do community, sexual, and reproductive health, there's only 8 posts available, with the competition being 34. Whereas cardiothoracics, there's only 11 posts, neurosurgery is 20. So you've got very little amount of seats available. IMT, you've got 1.6K spots available, with the ratio being 2 people competing essentially for every spot. This is not to scare you. Essentially, I'm only telling you this because I want you to be aware that there is competition. So therefore, you need to put in the effort in order to beat the competition. That's the only reason I'm telling you that. Because essentially, you're just competing for one spot. You just want one seat. And you can do it if you're tactful about it. And there needs to be an element of forward planning from when you're a medical student as well. So let's go through the portfolio toolbox. And this is the things that I had absolutely no idea about when I was a medical student, did not know about it when I was a foundation doctor either. So it's things that you tend to discover once you get to that stage where you finished foundation, or you're finishing foundation, and you're getting ready for high specialty training. So let's go through it step by step. Oops, sorry, went through a lot accidentally. All right. So these are just important points. So we use a website called Oriel, and this is a website that you will use as a final year medical student in order to apply for F1 posts. And you also use Oriel when you're applying for higher specialty training. Okay, so it's like a national centralized website that we all are using, no matter what specialty you want. So things that you need to be aware about is that with every domain so the portfolio is divided into different domains, and each specialty has their own particular domains that they care about. Okay. But I'm going to show you there's a lot of similarities. So for instance, most specialties care about, do you have experience in teaching? Most specialties care about, do you have any publications? Most specialties care about, do you have any prizes? Okay. So for each domain, you essentially click whichever one you've got the points for. And then and if you've got one particular achievement that fits more than one domain, you can claim points for both domains. An example that I always give is, let's say you went to a national conference, you presented your research, so that gives you a tick for oral presentation at a national conference. But let's say you also won a prize, so that gives you a tick for also the domain regarding prizes. So it's one thing that you've done, but it gives you points for two different boxes. Now, one thing that caught me out and catches a lot of people out, when you're submitting your application for higher specialty training, they care only about achievements that you have already achieved. So it doesn't matter that, for instance, you're in the middle of a really cool research project and you're about to get it published, and you may get or even, let's say it has been accepted, but the presentation is the following year. You cannot claim points for that. So that's why I always say plan ahead and try to get as many points earlier on and secured. And also, they always say don't overclaim, otherwise, the GMC is going to get involved for lying. Okay. So the main one. So before I kind of go through all of the different domains, what I'm going to tell you guys is essentially what the generic categories are that entail portfolio. This is not exact to one speciality. Okay. So the way that I played it, essentially, I made sure to have a very broad portfolio that I can then tweak to the specialty that I wanted to do, because I realized there were common strands and common themes between most of them. Apart from, like, for example, with GP, the main thing was you need to do your MSRA. They didn't care for you to have a portfolio, but that can change. As you can imagine, as the competition goes up and up and up, people can either introduce a portfolio or they can make the portfolio even more stringent. So it's best to kind of go in with a broad approach. So category one is all about commitment to speciality. So think about it like this. So how do I show whoever is looking at my portfolio that, okay, this person really wants to become a surgeon, or this person really wants to become a radiologist? So different ways that you can do that. Firstly, as a student, you can take a medical elective in that specialty that you're interested in. So whether it's radiology, pediatrics, you name it, you do an elective in that. Certain medical schools offer student selected modules. Try to think carefully about what student selected modules that you take, because that can be part of your commitment to speciality when you are 4 or 5 years down the line applying for training. I would always recommend, especially the medical students, to enter competitions. There are so many competitions. If you literally type in medical student competition, you will find an array of different competitions, including essay competitions. Or can you make a YouTube clip about this particular, about cardiovascular health? Can you create a poster? What about doing a research presentation? So there's always things that are very targeted to medical students specifically. And there's also things that are targeted to junior doctors. So I would say really try to compete as much as you can with these particular competitions. Next, I would say is particularly when you are a junior doctor, as an F1, you are allowed to do a taster week, okay? And this is paid. So you're allowed to have 5 days off work where you are allowed to go and experience a different speciality. So take advantage of that. They always say, especially with busy rotations, you need to give them a heads up so that they are aware, okay, that week, don't expect so and so out to work because you're going off to explore psychiatry, for instance. So another thing that I would say is in terms of um, conferences. So there's a lot of conferences that are available as well. And what I would say to you, bear with me just 1 second. Yeah, so what I would say is in terms of conferences, there's a lot of conferences that are again targeted at medical students, where they'll even give you a free ride to attend, whereas they're charging us hundreds of pounds to attend the conferences. So study days, taking a module. So there's this website called ELFH where you can register, and there are hundreds of different modules that you can take, and they will give you certification as well. Again, that's what I did when I was applying for radiology. I registered on this website, did a few, I think, chest X-ray module, got my certificates just to show, hey, outside in my spare time, I try to learn a little bit about X-rays. Doing an audit or a quality improvement project in your chosen specialty is key to showing commitment to specialty. If you do not know what specialty you're interested in, be broad. Maybe do an audit in medicine, do an audit in surgery, do an audit in pediatrics. You have the time, especially if you are a first year, second year, third, whatever year you are in medical school, or even F1 and F2, go every department, every consultant has to do some type of research as part of their appraisals anyway. Registrars, we all have to do it. I love it when somebody comes to me and says to me, look, I'm willing to kind of do your data collection, or I want to get exposure to this, can I please help? So be keen. Intercalated degree, as mentioned, I did an intercalated degree. It's not necessary to do an intercalated degree, but if that is something that your medical school offers, you can do it. As I mentioned, courses and logbook. So especially with surgery, they want you to keep an online logbook of all of the surgical cases that you've scrubbed in with your consultant co-signing it. Okay. So if you as a student are doing a surgical rotation, get a logbook already. Start getting your signatures now. You do not, this is the thing, you do not need to wait until you are a qualified doctor before you start collecting any of these. Anything that you achieve in medical school counts for your higher specialty training, which is something, again, I did not know. I was having time of my life in medical school. I did not know that anything, actually, apart from passing, I didn't realize I could have done so much. But I was lucky that I accidentally ended up doing things that really gave me a lot of points when I was applying. Okay, next category. Clinical audits versus quality improvement project. This is something, again, it's really important for you to do. And it's important to actually know what the difference is between what is an audit and what is a quality improvement project. So what an audit is when you are assessing whether the care that's being provided is, and by your department, for instance, is actually achieving a recognized standard. So you're comparing current practice versus a standard that has already been set either within a local level, national level, or an international level. Okay, audits are very easy to do because essentially, if the audit said, for example, if the standard is so anybody who's suspected to have potential pancreatic malignancy needs to be seen within 2 weeks. That is the standard. 100% of patients should be seen within 2 weeks. You then see, okay, what percentage are we hitting? Okay, we're only hitting 50. Why are we then hitting 50? So that is basically what an audit essentially is. An audit has to be practice versus standards that's already been set. So it's very stringent and it's very clear cut. And what I'm showing you now is what a cycle looks like, okay? And the reason I'm using the word cycle is because I'll come to it in a second. So you choose the topic that your audit is going to be about. And if you as a student don't know, or if as a foundation doctor don't know, somebody senior to you will have an audit running or an audit idea. So you choose a topic. You then review the standards that are required, okay, for your particular topic. You then collect the data based on what is currently happening within your department. You compare your data versus the standards, and then you make a recommendation of how to make change. And this is what we call a cycle. audit cycle. A lot of the specialities will say to you, we want you to have done 2 cycles of an audit, or they will use terminology called closed loop audit. Okay. So it isn't enough to just kind of do this once, because what happens is you get to this level where you say, okay, you know what, I think we should do X, Y, Z in order to do something better. But you haven't seen whether or not your recommendation has been implemented. You haven't seen what change has been made because of your recommendation, and you haven't proven that your audit has led to a positive outcome. So that's why make sure you do a closed loop cycle or 2 cycles. Okay. So that is what an audit is. Now, moving on to what is a quality improvement project. This is different from an audit. Essentially, it's a bit more, I would say, a bit more lax, because we're not comparing it against a set standard, as I said to you, that's already been decided for you. Basically, what you're doing is you're trying to identify, is there a deficit in the quality of care that's been provided? And then you aim to improve it by making small cumulative changes and measuring the effect. And as I mentioned, it differs from audits, because in an audit, you're looking at practice versus formal standards, and versus a QIP where you make small incremental changes. So this is a busy slide. I'm not going to go through it. It's just for your reference, and I'm going to share it, of course, at the end. But essentially, what I want you to guys be aware about is QI gives you points in your portfolio, and it's easy to do. And I'll give you an example of a QI project that I did. So, for instance, patients, when they were coming into the endocrine department that I was working at, who were smokers, for instance, the recommendation is we should really be offering them some kind of smoking, like a cessation therapy. So even giving them like a nicotine patch, for instance. So what I then did was, okay, firstly, I identified how many people within our department are smokers. Okay. Then I worked out, okay, how many of the people that are smokers did we offer nicotine patches to? And I found out that out of all of the people that were smokers on our department, we were only giving nicotine patches to about, I think it was about 2% of patients. So what I then did was I did a little bit of a teaching session within the department about the importance of making sure that people who are smokers were given nicotine patches to avoid them having to leave the department to go smoking outside, essentially. After the little bit of teaching, then afterwards I checked it again. And then this time we found that we increased the number of people that were being offered nicotine patches to about 50%. Then that is what we call a QIP cycle. Okay. Now you need to do, as I mentioned in here, you're doing small incremental changes. So that is 1 cycle. And then I did another cycle by trying to increase that 50% to 100%. So that is essentially what a QR project is. Next bit. Oh yeah, so I've just copied and pasted it from the internal medical training doctors points scoring system for QI projects. So essentially what they want to see is, what is a topic for the QI project that you've done? QI measures have been identified, so the process, the outcome, and the measures. What kind of QIP methodology did you use? What change did you implement? How did you evaluate that change? And how did you further apply the QIP? So in the scoring system, they will say, for instance, have you been involved in all parts of a cycle of quality improvement project? Or they will say, have you been involved in more than 2 cycles of a quality improvement project? And people get really stuck because they think that a quality improvement project needs to be something really dramatic and really drastic, but it really doesn't. It can be something, all it is have you identified something very small within your department that you can improve? And can you show us your methodology for how you improved it and show us the result of that? And one of the models that I use is something called the PDSA model. So I want you guys to go away and just read about what a PDSA model is. And I've just given you guys a screenshot of what that is. Essentially, it's just a method of how we do quality improvement projects. Category 3, presentations and publications. Again, as a medical student, they love asking medical students to join these conferences, to give a presentation. And all you need to do is just really Google it. Just Google medical student presentation. And another thing that I would advise is every Royal College. So you just type in Royal College of Emergency Medicine, Royal College of Radiology, has conferences going every single year, multiple times a year. And they always will have a segment where they try and encourage medical student involvement. So I would advise people to try to aim to do an oral presentation at a medical meeting. You can interesting cases, interesting topics. It's important that you understand that for point scoring, they will differentiate between whatever you've achieved. Was it at a local level? Was it at a regional level, a national level, or an international level? Okay, because you get more points if you've done a presentation at a national/international level. Another thing that would help differentiate in terms of points is whether or not were you a first author in the project that you've done, particularly with publications, or a second author as well. As I mentioned, trying to get involved in poster presentation. If you're getting anything published, try to aim for it to be PubMed cited because, again, certain specialities like surgery will give you more points if it's PubMed cited versus if you just published an article in a random research, like a non-peer reviewed research paper. And the IMT said, oh, but you get points for publishing a chapter in a book. I mean, for the creative ones who are great writers, you can add that as well. Next is as prizes and awards. As I mentioned again, local, regional, national. Okay, so it's important that you are clear. If you're getting a medical school prize, that will be a local prize, or if you're getting the prize within your hospital, that's a local prize. If the prize is something that was open to all a cluster of hospitals within a particular region, that's a regional prize. If the prize that you've competed for is open to everybody within that particular country, that's a national prize. And I might add, it does these things, everything I've talked about does not have to be in England, okay? It can be in the country of wherever you are doing your medical school training. And every single thing that you achieve, get evidence. It is a headache going back to your medical school, like I had to do, and try to beg for letters and evidence for your portfolio for something that you achieved 6 years prior. You can get points for scholarships and elective prizes, especially for those of you that haven't done your electives yet. There's loads of competitions that are going where they'll give you like £100, £200 towards your elective, and that's still a prize. Certain specialities are recognized if you've had honors or distinction or equivalent within your medical school. So if you were the top 10% of your cohort, which I certainly wasn't, so I never got points for that either. Category 5. Now, teaching. Again, this trips a lot of people up because they think that it needs to be, again, something really fast. What trips people up is the fact that your teaching has to be happening over a 3-month period, okay? So they want you to have designed and led, I'm only talking about the highest scoring points, okay? Designed and led a local or slash regional slash national teaching program. To get the highest point, it's a national teaching program. And it has to be done for at least 3-month periods. So now, how to achieve this? So for instance, if you pair up with friends from different training programs, so for example, if you're based in Birmingham and you want to create a teaching program and you work with a friend who's in London and another friend who's in Manchester, and then you open up your program to everybody within the country, that's now a national teaching program. So I did something similar where I basically worked with my friends from different areas in order to create a national teaching program. And it doesn't have to be every single day. Like if you do one session a week or one session every 2 weeks over a 3-month period, that will give you the marks that you need to get the highest points. For surgery, for instance, they said that they want to see that if you work with educators to design and organize a face-to-face teaching program. So they've set a series of sessions defined as 4 or more healthcare professionals or medical students. Again, it doesn't necessarily have to be targeted at medical students or at doctors. For instance, one of my friends, she created like a teaching program where she was teaching the healthcare assistants. I remember your healthcare assistants how to check glucose levels on the ward because they weren't all signed off. She then was creating some kind of teaching program along that. Anything that you do in terms of teaching, you must make sure that you get formal feedback because that is part of your portfolio essentially. And as I mentioned, making sure you get feedback and keep it saved on Google Drive, making sure you get a certificate to show that you've designed this teaching program as well. Next category, I would say, is teaching qualification. So most specialities will also give you points for teaching qualification. Highest is if you have a master's in teaching. The next is if you've got a formal teaching qualification, such as a PG cert or PG diploma in teaching. Or the lowest one is if you've got evidence of training in teaching methods, such as teach the teacher or teach the trainer. And that's a 2-day thing. There's a couple that are free, the rest cost like £168 or something like that. So you need to, I personally, for instance, to get a PG cert, that's a whole year's worth of work, right? So for somebody that was like last minute, that wasn't going to work. But if you are somebody that's still got a bit of time, you can start taking a PG cert by doing a module every like two modules here and there, and just try to get your PG cert over a 3-year period if you're keen. Category 7 is all about leadership and management. Again, you know, when you get emails saying, oh, we want a year group representative, or this society wants a representative for surgery, and people just feel like it's a bit of extra work, it gives you points, essentially. So I'm giving you examples of certain specialities that I've said, for instance, if you hold or have held a national level leadership or managerial role involving this speciality, you will get the maximum points. I think like radiology was given like 8 points for that, which I thought was hilarious because who has national level leadership? But then there's other things. You can become a BMA representative. You can become a member of an undergraduate society. Another thing that I recommend, especially to medical students, if your university does not have a society, for example, ENT society, create an ENT society, make yourself the president, and then you'll have that certificate to say that you created the society within your university. And this helps you with your commitment to specialty later on. I was like, what was I? I think, oh yeah, I was like the vice president of oncology society at university. I definitely did not do anything with oncology, but it's just to give you an idea of things that you can do. And typically they say it needs to be over a 6-month period. Another thing that I would say is that's leadership in the sense of from a medical perspective, but like ACCS, for instance, if you want to go down the anesthetics A&E type of route, if you look here, they will give you maximum points for showing commitment to altruistic things such as charity, scouting, guide events, where you're an expedition leader. So being a leader doesn't always necessarily have to be specifically within medicine. It can also be seen within anything that you might be a hobby of yours as well. So next, and this is category 8, is the final category. I'm going to stress this to a lot of you. Try and sit exams as early as you can, rather than putting it off when you have more commitments. For instance, you can sit your MRCS. If you're surgically inclined, you can sit your MRCS as soon as you finish medical school. You do not need to wait until you've got your full GMC registration for MRCS Part 1. For MRCS, for MRCP, for the physicians in you, Part 1, you can sit that, but you need to have at least had 1 year of experience working as a doctor. Then you've got MCREM, which is like the primary for A&E. Again, once you've qualified for medical school, you can sit that exam as well. Another exam, this is specifically for undergraduates, for anybody who wants to do ophthalmology, I urge you to sit the Duke Elder exam, because the Duke Elder exam is an exam that you can only sit as a student, which will give you a lot of points when you are applying for ophthalmology. And as I mentioned, ophthalmology Part 1 exam, refraction certificate. I don't know what this eye thing is, but some assessment as well. Try and sit your exams earlier on. I think for me, once I finished finals in medical school, I had absolutely no desire at all to sit any exams. So I just had fun and just enjoyed my life for the first 3 years, but I did not have to sit an exam. But funnily enough, radiology was giving you points for if you sat Part 1 MRCS or if you sat Part 1 of MRCP. And I definitely did not sit either of those. We're just going to be wrapping up shortly. So one thing that I'm going to urge you guys to do is please, please, please have a look at your person specification now. What that is every single specialty has something called the person specification, where it's a PDF where they've listed all of the things that they require for people that are applying for their specialty, the desirable attributes and the compulsory things as well. So it's very, very important for you guys to start having a look at it. It changes every single year based on whether or not they tweak things. What I've noticed over the past few years, they're putting a lot more emphasis on the portfolio. And there's so much that you can do, so many competitions, so many essay competition posters, research. You could get 5, 6, 7 papers published if you've got the time. So just to wrap up some advice. So what I would say is collect evidence as you go along. Keep a physical and an electronic copy of all of your achievements, okay? And really, really try to push yourself to be as engaged with your portfolio as you can. I know that you need to focus on your medical school exams or your foundation program, just kind of like turning up for work as well, but you're doing yourself a favor. Make sure you do a lot of forward planning. As I mentioned, keep a diary. Trust me, you are helping the future you. If you want to know where can I find all of these competitions, research, etc., Twitter is really, really good. A lot of like the royal colleges or the societies promote their competitions on Twitter. LinkedIn, and as I mentioned, every royal college's website, you need to go into that and look at the events. Work with a buddy, especially with teaching programs, because that's what I did. It's a lot easier if you're working with other people and you can all get points for it, right? Because you can all be leaders together. As I mentioned, the competition ratios will continue to go up. Do not get flustered. You're just trying to get one spot. So just why not you? And I always say this to my friends as well, why can it not be you? So plan ahead, stay ahead. As I mentioned, track. And finally, just remember that irrespective, there's no real loss that you're taking. And what you call it, every no is just a redirection and the path will unwind in the most perfect way. And one thing that I live by is that everything that's happening is happening for you and not against you. And this is a link of resources. Again, all of this is going to be shared, where it's just a link for different prices, different competitions that you can look at. The ELFH website that I mentioned. This one, I would say, especially for the medical students, please have a look at it. It gives you an idea of what are the competencies for foundation program, a bit of a rough guide about the different lingo of how the departments are set up, just so that you can have an idea of where you're heading towards. And the final slide is a thank you for your attention. I used to love Grey's Anatomy. So one of my favorite lines from Dr. Webber was, "This is your starting line, this is your arena, and how well you play, it's up to you." Okay, I'm gonna stop sharing. And so the next speaker is going to be Dr. Regal. You could just unmute yourself and put your camera on.
Can you hear me?
I can hear you.
Okay. Hi, everyone. Salam alaikum. My name is Aisha. I've got a night shift. I'm about to start in about, inshallah, 25 minutes. So I'm going to talk about my experience as a foundation doctor. I finished medical school in 2018 in Sudan. I grew up in the UK and we moved to different countries. We were Somali nomads. So I was born in the Netherlands, lived in Kenya, did my medical school, and came back to the UK. So I did grow up in the UK. I was actually a classmate, Sumayya's classmate in year 7. I started my foundation program in 2020 during the second wave of COVID, which was a very hard time to start foundation program because it was not easy getting the kind of training that we wanted because everybody was busy dealing with the COVID patients. So I actually got COVID 1 week into shadowing and was nearly hospitalized, but alhamdulillah. I got my GMC registration while I was shadowing. So usually the F1 starts around July, and because of there was lack of exams, the IELTS exam, OET exam, I could not sit for the exam. So I had to shadow my F1 and F2 colleagues while I got my GMC registration, and I got my registration in October 2020. I started my FY1 in West Midlands North, near Wales, a hospital in Shrewsbury. Everything was not computerized, so it was handwritten. So it was much easier for me to get used to the system because I was used to writing back in Sudan. Everyone used to say, "You've got beautiful handwriting," but not so sure anymore because of working with computers for the past nearly 3 years now. My first rotation was general surgery, upper GI subspecialty. I remember my first night as an FY1. I was thrown into the deep end and I had a very unwell patient with a new score about 9 or 10. And my SHO, who was the core surgical trainee at that time, and the registrar were both in theatres. So it was me and the nurse in charge. I was called up and was told, this patient's got a high new score, he's hypotensive, got low saturation. And I'm like, subhanallah, what am I going to do? And I was like, let me start with step 6 first, because in medical school as an IMG, we're not taught 8E assessment properly. So what I did was I was like, let me just start with the 6, 3 in, 3 out, and then I asked my nurse, please continue calling back to back until they come. So alhamdulillah, my SHO arrived and she did not know what to do with the patient herself. And I remember she was confused, and that kind of rubbed me the right way, because that gave me confidence that I actually did a little bit. And she was happy that I took the bloods. But what she did was I peeked and looked at the way she was doing it, the 8E assessment. So when you're an IMG trainee, it's very good to have a look at what your senior doctors are doing. So we asked our nurse in charge and told her, what do you think is happening? Because as a doctor, you're not working as a doctor, you've also got the team around you. So the nurse in charge asked us to let's look at the drug chart, and then we found out that the patient had a PCA, which is a patient controlled analgesia, morphine, because he had so many fractures and he was in so much pain. We provided a PCA, so he overdosed on the morphine. And alhamdulillah, we gave him naloxone, and all the effects were reversed. So as an FY1, you are the vital part of the team, and you're also the baby of the team. So you'll get a lot of support, unless you're in psychiatry or ENT or in the as a FY1 surgical FY1. So the first 2 weeks of each rotation is usually tough, because our British colleagues, British graduate colleagues, tend to go to the hospital in their 3rd year, 4th year, 5th year, so they already know the NHS system. But for us, we do not know the system. We do have the knowledge. So getting used to the system takes a bit of time. But usually what I do is I have a notepad, I write everything down. What I used to do is when I go home, I would just read up on it a little bit. And then alhamdulillah, by the end of my 2nd rotation, everyone thought I was actually a British graduate because I got used to the system. And then I was transferred to Birmingham for just before my last rotation, my F1 rotation, due to family circumstances. And it was a whole new experience, because in Birmingham, everything is computerized. I'm currently working in Queen Elizabeth Hospital, Birmingham, and everyone is using the computer. So you can imagine I did not know how to type anything. So it would take me time just to write one sentence. I'd be like, Q, U, I, and then the consultant is just there looking at me. And I remember one of the consultants told me, are you a slow typer? I told him, and that's when I used my IMG card. I told him, oh yes, I'm an international medical graduate, I'm not used to the computers. And that is something to be like, yes, you're right, I don't know, but I'll get better. And then what happened was, a year later, I worked with the same consultant, and he asked me to work with him the following day. He was like, you're a good typer, can you please work with me? He forgot that I was an F1 last year, and by then I was about to finish my F2. I remember calling my younger sister, who's also a doctor, and telling her about this. So I was like, do you remember the doctor last year? Yeah, alhamdulillah, this year. So yes, Sumaya said everything, and I think it's very important to be proactive, because British graduates have a head start before us. So whenever you start a new rotation, look for the doctor that's easily approachable, usually an IMG graduate, because you would have similar circumstances and experiences. So what I used to do is, whenever whenever we don't have many jobs, I would sit next to them and be like, hi, so where did you graduate from? I graduated from this country. Oh, I graduated from Sudan. How do you find everything? What do you think I should do? So what they would usually tell you is, they will tell you about any audit projects that are going on, any QIP projects that are going on. And then what I would approach the registrar on that project and be like, can I please help you with data collection? And they would be very happy, because some of them don't have the time to collect the data. And when you help them collect the data and help them present, you would automatically be part of that team. And it would also give you a points on your portfolio, attending courses outside of your hospital. I usually take part in the University of Birmingham OSCE preparation for the 3rd year, 4th years, and 5th years, and I get certificates from those, because in the future I want to be in academia. The other thing is I always ask my IMG colleagues to ask for help. Make sure you ask for help. It's better to prevent a mistake than correct it later. So if you don't know what you're doing, make sure you call your senior colleague and be like, I'm going through this. I've seen this patient. Tell them about the SBAR, and tell them about the situation what you're about to do, and tell them, is this correct? Rather than doing it on your own and making a mistake and getting in trouble, because that would cost you a lot, because you'd have to write a day text. You'd sometimes be you'd have to speak to your senior consultant, who's your supervisor. It's very hard to correct a mistake, especially as an IMG. We have an extra light upon us, and it's very easy for us to lose our licenses. I also advise my colleagues to avoid being burnt out and enjoy while you're working. For example, I know it's very hectic working as a foundation program doctor, but what I usually do is, if I'm working for 6 days and I'm off on the 7th day, I would meet up with my friends. I would go to the gym. Try to go for a walk, because those things that will help us decompress. And also, maybe even if you're not able to go out of the house, a simple telephone call to a fellow IMG doctor to talk also helps. What we have in the British Somali Medical Association, we've got teaching sessions where we come together. We also have catch-up sessions amongst the IMG doctors where we talk about our experiences, and that really helped me during my foundation program. In those sessions, we talk about any issues that we face, any funny cases that we've seen in the hospital, and it was a very nice way to see that, oh, we are going through the same problem. We are having the same. Don't be shy and don't be arrogant. One of the tabi'een said, "Al-mustahi wal-mutakabbir la yata'allaman." So if you're shy or if you're arrogant, you will not learn. My takeaway final points is, don't be shy, ask for help, be proactive and engage in projects that are being done in your department. Work on your portfolio and make time to update your portfolio every 2 weeks, maybe, or at the end of each week. It's better for you to update your Horus portfolio, which I think one of our colleagues will talk about later on, rather than waiting towards the end where you have so much to input and chasing your senior colleagues. It might be hard to chase your senior colleagues. And enjoy your off days to avoid depression and burning out. All right, yeah.
Thank you so much, Dr. Agal, for sharing a bit of your experience. So the next person that's just going to share a bit about experience is Dr. Usman. He is basically going to focus about how to secure an F1 post, graduating from abroad. Okay, I'll let you start.
Assalamu alaikum, everybody. Just a moment. I'm just trying to get my PowerPoint on. Ooh.
No worries.
Is it there? Can you see that?
Yeah, fantastic. Yeah, we can see it.
Okay.
It's just on the third slide at the moment.
Oh, yeah, there you go. Okay.
Yeah, amazing. Okay, thank you.
Hi. Yeah. So yeah, mine will be quite short and sweet, and it's specific to international medical graduates who are trying to apply for foundation program. So that's specifically in the case of if you haven't done an internship. Yeah. So intro, my name's Abdurrahman. Currently, I'm finishing my F1 in the east of England. I graduated from Egypt. I went to Missouri University of Science and Technology. I had to go through this process as well during COVID, which was quite difficult as well. I think it was a hard time for everyone. But alhamdulillah, we got there in the end. And what else? Yeah, I think that's about it. So what is the UK FPO? So the UK FPO is a 2-year structured training program for medics in the UK. And it's mainly meant to bridge between medical school and when you decide whatever specialty you're going to go to. So it consists of F1 and F2. And during that, each year you'll have about 3 rotations, each one 4 months long. That's the standard. Most places it's like that. Heard of a few places where it's slightly different, but that's usually the way it is. The good thing about F1, which is your internship year, It's basically, yeah, that first year after med school is you can't practice unsupervised. So that's both a good and kind of bad thing, depends on your experience. But if you want that, that's it's really good for that. And yeah, during your F1, you'll have to meet a certain number of criteria that is reflected in your portfolio, and it's meant to show your competencies and skills. So for the foundation program, there's about 3 different types. There's the foundation program, which is the normal, the standard. And then you also have something called the foundation priority program. This just tries to help people who are in a bit of a bind, who are maybe stuck in a specific location or want a very specific specialty. And it's meant to help basically those type of people who are a bit more rigid, because the foundation program it tests your flexibility in the sense if it can throw you anywhere in the country, and you don't really have much say in it. The last is the specialized foundation program, and this is for those people who are a bit more interested in academia and research, and very specific, maybe specialties like neuro and things like this. They accommodate that. So to be eligible for the foundation program in the UK, you need to have these 5 things. The first is, of course, a degree in medicine. The second is you need to have English language proof for English language proficiency. And that can be reflected, either your medical school is on the list of universities that they acknowledge, or you have to do the IELTS and OET. The one difference here is that for the GMC, for like general GMC full registration, you only need a 7 in the IELTS, and for the OET, I think you need a 350. But for the UK FBO, they want a little bit more. They want you to have a 7.5, yeah, on average, and at least a 7 in all domains, and a 400 in your OET. So it's a bit harder to get those. And yeah, you need to also be GMC registered. So you need to pass your PLAB 1 and PLAB 2. You need to have a right to work. And if you've graduated 2 years before the date that you're supposed to start, then you'll have to also do an additional exam, which is another OSCE, that we'll talk about a little bit later. So yeah, so how to apply to F1. So it's all on a website called Oriel, and yeah, you fill in an online eligibility application form, and then you just upload all the requirements that they ask of you. Just a few disclaimers from the UK FBO. This happens in July, and so they don't provide any pre-checking service. So if you say, for example, have a document that you think is your primary medical qualification, but it's not exactly what they want, there's no way for you to have that verified by them to make sure that you're providing the right document. So you just have to really look into everywhere to make sure that everything that you're sending is right and what they want, because they'll only either accept or decline it. And that will only happen at the eligibility once you've submitted. Once you've submitted, you can't add any further documents, and none of this can be undone or edited. So this is roughly what the timeline will kind of look like. So the eligibility application window will open in July, and also they do change these dates around, but I'm just giving you an idea so you have an idea of what it'll look like. So the eligibility application window opens in July, and then you'll apply, and in August you'll find out whether they accept you or decline. You can appeal, but they're quite difficult people in that way. So yeah, so August they'll tell you whether you've got in or not. Then this is a period where you need to have done the PLAB 1 and PLAB 2. So the PLAB 1 for people who are doing the UK FBO, because you're applying in July and you'll hopefully start August the next year. They support you to get PLAB 1 and PLAB 2 seats, so to make sure that you meet that you're able to get your registration. So in August, if you haven't got a PLAB 1 booked, they have certain ones reserved for you, and you just have to speak with the GMC, show them that you've passed the eligibility window, and they'll allow you. They'll basically give you a seat. Then from September to October, the application window opens for foundation program, the FP, the FPP, and the SFB. You can apply to all of these, by the way. It doesn't hurt, but you must, the one that's compulsory is the FP. You have to first apply for the foundation program. You can apply for the others and hopefully get in, but if not, you'll be in the foundation program. And that goes from September to October. So for those people who, and it is those people who will be out of, they have a bit of a gap between med school and when they'll start. That's more than 2 years. Then you'll also have to sit the CSA, which is an OSCE similar to PLAB 2, but the PLAB 2 is to the level of an F2. It's testing you to the level of somebody who's already had 1 year internship. But the clinical skills assessment is testing you to the level of a graduating medical student or F1. By December, you must have passed your PLAB 1. If not, they'll kick you out, basically say apply next year. Then in January, the PLAB 2 priority will open where they'll help you if you haven't got a PLAB 2 seat, because it can be quite difficult to book these tests. So they'll help you get a seat. And by May, you must have made sure that you've got a seat. And by June, they want everything. They want your medical verification. So that's your EPIC to get your medical degree certified. They want your PLAB. They want it all. And then hopefully in August, you'll start. This is kind of a map that shows you all the different deaneries. So when you're applying for the foundation program, they might put you anywhere, really. You just, so you'll list all of these places in the UK. There's about 20 of them. And you'll list them in the order that you want. So you might say, I want Birmingham first, then everything around Birmingham. Or you might have picks based on hospitals you'd hope to work in, whatever. And depending, now I believe there's been a bit of a fuss. So the thing is, they change this every year. So if you're applying this year, then it'll be however they've said in their handbook. But each year it's changed, because I applied last year and this year is so different to how I've already applied. And their ability to give out information is quite poor. They just have social media and one website that they update very randomly. So yeah, so they'll randomly put you in one of these deaneries, and then so that'll be the first phase of the program. Then the second phase will be picking what jobs you want in that area. Yeah, so to kind of summarize, what is the tips and takeaway I can give you based on what I've done is that this whole system, the UK FBO, is rapidly changing. I would suggest that you follow them on social media, them and the GMC. You frequently check their websites. Even if you feel like you have everything sorted, just keep checking their website, because I know personal stories of people who due to a random change very last minute had it delayed. And the difficult part is if you do get delayed or your application is rejected or stopped because you haven't met some criteria, you have to wait until next year to apply for next year. So you can easily end up losing a lot of time. So I would say it's not a hard thing to do. It's just they're not very good at giving this information out. So you have to be very, very vigilant. The other thing is they have a UKFB application handbook. They change it every year, so make sure you're looking at that. The English requirements are different. They want a 7.5 in the IELTS, which I know for everyone who's done the IELTS can know that it's a bit of an annoying exam to do. And trying to get a 7.5, it's even more annoying. Yeah, the CSA, that happens in November. I just wanted to briefly, because the CSA, it's an OSCE that happens very fixed time in November, and it's pass or fail. If you fail it, then your application's withdrawn. If you pass it, then you can go on. There's no second dates. There's nothing like that. It's not, because this can be a big source of stress for a lot of people, and it makes sense because you don't want to lose potentially 2 years. So, but it's not a difficult exam. They're not trying to fail you. I would say it's quite an easy exam to pass, but it does require you to put in the right amount of work. So it's very, very doable. Just yeah, don't be discouraged or sabotage yourself type thing. And lastly, university references, sort this out sooner than later, because again, that's not something that will be in the handbooks or anything like that, but they will request from you university someone from your university who I think it's like assistant professors or senior administrators. That's the only thing they'll accept. And they want to make sure that they'll ask that of you on very short notice. So make sure you have that sorted out, basically. And that's it. That's the end of my presentation.
Amazing. Thank you so much, Dr. Asman.
Yeah.
Appreciate it a lot. Very, very helpful. And next person is going to be Dr. Ilmi. Yeah, amazing. And he's going to focus on gaining full registration. Assalamu alaikum.
Let me just pop my PowerPoint.
Yeah. And in the meantime, guys, if you just keep posting your questions into Slido, after Dr. Ilmi's talk, we'll be going through the questions, inshallah. Okay, off to you. We can see your screen. If you just go to full screen. Yeah, perfect. Thank you.
All right. Assalamu alaikum, everyone. Hope you're doing well. My name is Abdirahim Elmi. I am a doctor who graduated from Romania. I graduated from the University of Oradea back in 2022. So it hasn't been too long since I graduated. I'm one of the lucky ones in terms of a lot of things that worked out for me. What do you call it? So one of the requirements for full GMC registration is to do the PLAB. So I'm lucky in that terms because I didn't have to do the PLAB. So let me slowly go through everything. So the difference between full registration and provisional registration is that you get to skip the first year of the foundation program. You don't have to do F1, you can skip straight into F2. But it's not necessarily the foundation program you get into, but it's the same levels. So it's called Foundation Year 2. The reason this works out for me and a lot of people in my position is because the university I graduated from, it was a 6-year course. So my final year at uni counts towards my internship, which is one of the requirements we have to provide. So going on a little bit further, one of the main things that you need obviously is your primary medical qualification. If this was outside of this, the UK, and in this case also Switzerland that do mention. And sorry, I just lost track a little bit. I'm not used to speaking to an audience who doesn't really talk back, but I'll try to manage my way through it. So yeah, so the final year of the internship really does, final year of uni in some places does count as an internship. So the internship also is very similar to the foundation, first year of the foundation program, or also the foundation year 1. Went through different specialties. In my case, I went through infectious disease, psychiatry, obs and gynecology, public health, dermatology. So with that, I was able to show that I have experience in those different departments. So they let me skip that year, or they let me apply for full registration. So once you do have a acceptable primary medical qualification, I have a list of the qualifications they do accept. It's in the PowerPoint. I'll show you later on, and obviously I will post or I will give it to the leaders so they can forward it to whoever wants the link. Most of the data I have in my PowerPoint is directly from the GMC. They are the best source in terms of getting the right information that you need. Obviously, it's subject to updates, and it's best to always double check what's going on there, if there's been any updates, and so forth. So yeah, so primary medical qualification that they accept. There's also another formal qualification list. They list it called the Directive on Recognition of Professions or Qualifications. Yeah. So a lot of people do apply for full registration. It's very different. It's not just medical students. There's also people who want to come to the UK. Especially it's people who want to go straight into specialty. People who are specialists who want to work in the UK. People who were in specialty training and want to continue their specialty training in the UK. And yeah, so everyone has different paths. But today we're going to be speaking mainly about what the path is for medical students. So carrying on. Graduates with an acceptable primary medical qualification after you graduate outside of outside of Switzerland or the UK, what you do need is a pass in the PLAB test. This is the medical exam that my colleague spoke about earlier. There's two parts, PLAB 1, PLAB 2. And for full registration, for example, in my case, the reason I did not have to do the PLAB test was because, I got a little bit confused there, but I meant to say that PLAB test is not an actual requirement, it's one of the ways that you can do it. So if you have an acceptable European qualification, which shows that you have the right knowledge and skills and experience, you will have to do that. But if you don't, for example, if your university was only 5 years long or something like that, they do require you to do the PLAB test. So another way would be a sponsorship by GMC approved sponsors. This is a way of getting in. I think it appeals mainly to people who are already have a couple of years of experience working in a hospital. And obviously, we also have our specialists. So this, at the bottom, you can see the link. That's where we get the relevant European qualification list from. What they do want is a primary medical qualification and an accompanying certificate. Usually they call this it's either the support statement or something along those lines. And it goes with the medical qualification. When it comes to eligibility, that's that side of things. When it comes to evidence that you need to provide, one of the sources is you go through EPIC, which is the electronic portfolio of international credentials. So they're the ones that verify your primary source, your primary qualification. It really does not take too long to go through their process. I know sometimes it can feel like that the process itself is long, but preparation is key, to be honest with you. Once you know what you're getting into, what's required from you, and you have a timeline, things do become a lot easier. And obviously, life is life. You know, sometimes you do come across issues and obstacles, and you know, patience will be your biggest source of strength. So obviously, English skills is another thing. I did the OET. I know some people do the IELTS as well. I don't know the exact gradings, marks, which path they use to pass, but obviously, same thing. Preparation helps you. There's a lots of courses online which you can go through if you feel like you can't do it by yourself. Practicing with partners, with fellow medical graduates, it helps a lot. And also an evidence of your fitness to practice. This is not a big thing. Usually it means that like you go to your GP or someone, let them know you don't have any concerning health conditions. So in terms of the two main things to look at would be making sure that you don't have to do the PLAB. If you do the PLAB, go through the right channels. You know, even the PLAB preparations, they have courses to help you. And you know, people always say that preparation as well helps in that case. Well, preparation helps for everything. Yeah, so getting the PLAB out of the way, if you have to do it, getting your English skills, OET, IELTS out of the way. Once you've done those, you can go through EPIC and put your documents through. For me personally, after I graduated in September 2022. It did take a little while for my diploma and stuff to come out. back then it did have something to do with elections happening in the country. Sometimes it can take a month, 2, 3 months. But once you do get your documents through, start the process, even before then, do your research, know what you need to do so you can, hit the ground running. And obviously, proof of internship. So when they ask you this is usually when you're applying through EPIC. And in my case, what I did was I just showed them the courses that I was taking during my last year of university, showed them the time I spent in hospitals, because towards the end of university, a lot of the time you're spending time in clinics, not really in lectures. So, it's a lot of experience, and, you shouldn't shy away from showing people the experience that you have, the places that you've been, and what you've learned. And yeah, that helps. Oh, yeah. I know
Amazing.
my slides was a bit short, but I hope I did get my point across, and it was beneficial to everyone.
Amazing. Thank you so much, Dr. Elmer. I really do appreciate it. What we're now going to move on to is see the Slido questions. If you just mind stop screen sharing, and then I'm going to ask yourself and Dr. Usman and me will go through all the questions.
No worries.
Yeah. Dr. Usman, are you there as well?
Yeah, I'm here.
Yeah, amazing. Okay, cool. I'll be directing certain questions to both of you guys based on the question. Okay, first, guys, just keep posting your questions into Slido and then we'll just quickly go through them as well. First question is, okay, so somebody asked me, how can we access the previous lectures? Since today's the last lecture, we're going to spend a bit of time like formatting things, and then it will be emailed out to the mailing list, inshallah. So next question I have is, the question is, how important are clinical attachments for IMGs when applying for jobs? Is it necessary, or is one attachment with a consultant reference enough? And Dr. Ilmi, what do you think?
In terms of just getting the registration or after?
For applying, it says here, how important are clinical attachments for IMGs when applying for jobs? Do you think it's important for them to do it?
Yeah, I think it's very important. Sometimes they say spend at least 2 months to 6 months doing a clinical attachments. And the reason it's important is because it boosts your CV and it makes you look better, shows you've had a bit of experience. So I do say it's important.
Okay, great. The next question is, as an IMG, I'll answer this question. So the question is, as an IMG, how can I show proof for quality improvement projects or teaching experience in our portfolio, especially when applying for non-training jobs? So in terms of the portfolio, a letter is sufficient. So it needs to be a letter that is signed by your consultant, preferably on hospital-headed paper. So whichever hospital that your consultant works for, a letter to just say that your this doctor has completed this particular quality improvement project. They presented it at the local departmental meeting. That letter plus a copy of your quality improvement project is enough evidence. Same for teaching. So what I did I got a letter for everything, every one of my evidence, I got a letter from a consultant or a certificate, whichever way it worked out. And then I would also attach a PDF of whatever it was. So for the teaching experience, for the teaching program that I created, I just put together a very compact PDF of the feedback that I got, plus a bit of a poster of all of the teaching sessions that I did as well, plus a letter from, or was it a letter or certificate from a consultant. For anything such as a course, so anything like Teach the Teacher, which is a 2-day course, you will get an automatic certificate as well. Now, in terms of the portfolio, so all of these typically, like even when you're applying for trust grade jobs on the NHS, there will be boxes, because I've helped other people with the application. They will say stuff like, have you got any experience with audits, or have you done any audits or QI projects? What kind of experience do you have for teaching? So they do still ask those kind of questions, even if it's a non-training position. Dr. Usman, the next question I'm going to give to you, it is for foundation program, as the eligibility deadline was in July. Is there any option to apply for similar programs later on, or do you need to wait 1 year if you've missed the deadline?
Yeah, so unfortunately, if you miss the eligibility window, which is in July, you have to wait until next July to apply. So yeah, it's literally, it's quite unfortunate.
Okay, thank you so much. The next question I'll take. So if our medical school requires us to complete a student selected component, such as a case report, I will be able to relate this to our portfolio. So my medical school, I had to do 2 student selected components. It wasn't the only option was what do you do within the student selected components, not so much the fact that you're doing it. If you already know what specialty you're kind of like gunning for, try to relate, for example, your case report to like a surgical case report or a radiology case report or a pediatric case report. So you can still alter the theme of your case report based on the specialty you're hoping to apply for. And then when you get into your specialty application, you can say, I did a pediatric student selected component, even if the title isn't per se. You should still have that case report to support you with that. Next question is for Dr. Usman. The question is the 1-year standalone F2 program more competitive than the foundation program? And what do you think? How can you recommend anything to improve chances of getting accepted into a foundation program? Essentially, I think is what they're saying.
So the standalone, because I did F1, F2, I wasn't applying. So you can only apply for the standalone if you've already done an internship. I wasn't really in that position. So I think Ilmi might be better. Dr. Ilmi might be better at answering that one. If it's particular. F2, maybe.
To be honest, I don't know too much about it.
Okay. I do know it's very competitive to get a standalone, and it's also there's like application windows. I don't know if it's 2 times a year or 1 time a year, but it can be a bit tricky and difficult to get.
Do you apply to the same way as you apply for the foundation program?
I'm not too. I think so. I think it's on Oriel as well, actually, because it's on their website. But I just never went down that rabbit hole.
That makes complete sense. Next question is, I'll take it. So it says, would you recommend doing courses such as BLS or ALS for your own experience and helping improve your chance of getting a job? And are there any other courses? So courses are very, very important. So things such as, so BLS, we had to do that as students. We even had to do ILS when we were medical students, talking from a UK perspective. ALS, you definitely have to do it as a doctor. So for the foundation program, they pay for you to do your ALS. So I think it costs like £100, £300, £400, £500. I know that the trust grade doctors in my trust, the junior clinical fellows that joined, they had to pay for ALS out of pocket. So irrespective, ALS is very important for you to do. You have to do it. The only things I would say is if you're doing it as a medical student, you have to revalidate every 4 years. So you don't want to do ALS too early, because if you do ALS like as a first year, you're going to have to redo your whole ALS again after 4 years to get recertified. But yeah, it is really relevant. In terms of other courses, there's so many courses. If you're doing surgery, for example, the basic surgical skills course, if you want to do ACCS, A&E, the ATLS course, the CRISP course, these are type of courses that are really important for when you're applying for those type of specialities. For radiology, one of the courses that they like is something called the Red Dot course. I think it costs like I did both. I did the Red Dot course, and it's like an X-ray course, and it cost me like £165 or something like that. One thing that I would say is if you are within the foundation program, you get a protected allowance of how much you can use in order to pay for these courses. If you're not in a foundation program, it is out of pocket. So it's just to make you aware of that. And next question is, any advice on how to find a clinical attachment within the NHS as an international medical student? Dr. Elmi, how did you manage to get your experience or any advice?
Yeah, I think the best thing to do is network, because a lot of times it's like it's people that you don't know that open up to you and give you a chance, and a lot of times it's searching for directories where they have lists of emails for consultants, reaching out, doing cold emails. In terms of the clinical attachment, I did it not too long ago. I think it was about 6-7 months ago, and I got lucky. I asked a friend of mine, and he happened to know a consultant, and even then, just because someone knows someone, it might not just be as easy. If the consultant's a nice person, usually he'll let you through. And looking at the UK, there's a lot of Muslim consultants. And, I would say don't shy away from emailing people, reaching out, asking around, because people are always willing to help.
Amazing. Thank you so much. That was the final question. So we're gonna wrap it up here. Everybody, if you could just please look in the chat. I've just put in the feedback form. If you could please just take your time to fill it out. This is the final session of the 10-part series. Thank you so much for joining us. Thank you, Dr. Usman and Dr. Ilmi, for helping support the session. And Dr. Igal had to go off to her night shift, but thank you to her as well. But yeah, you guys can as soon as you feel like you formally. Oh, Dr. Igal's still there. Did you just finish handover?
Yes, I came to another office.
Amazing.
Yes,
Amazing. Thank you so much. But yeah, thank you very much, everybody. I'm just gonna wrap it up here, and I'll stay on the chat just for another 5 minutes, just for those that want to have access to the link for the feedback form. But yeah, thank you guys so much. Thank you, everybody else.
Thank you, everyone. Salam.
I'm just going to stay here for a bit.
Salam.
Oh, so, alaikum salam. If you could just please fill out the feedback form, it will help me a lot. And then it's a wrap. 10 sessions. Hopefully you guys all found it beneficial across the series. Oh, thank you as well. Let's stop recording now. In terms of the